Hey everybody, I'm Dr. Christopher J. Allen, known as Sleep Dr. Chris, and thank you for joining us for this important conversation. We spend a lot of time in our families and communities talking about physical health, but brain health deserves that same attention too. Conversations about memory and thinking changes can feel scary, and sometimes they don't happen early enough because of stigma, fear, and misunderstanding. But my hope today is simple, that this conversation helps make brain health feel more normal to talk about, more approachable, and more connected to the way we care for ourselves and the people we love. I'm excited to be here with Ricky Lewis, Grand Basileus of Omega Psi Phi Fraternity Incorporated, and I'm looking forward to a real conversation that can educate, encourage, and hopefully help someone take that first step. So, Ricky, good seeing you.
Thank you, Dr. Chris. How you been, man?
I've been doing all right.
Good.
Welcome here. And I know I gave the introduction, but can you briefly just introduce yourself and the organization that you stand for?
Yeah, I'm Ricky Lewis. I'm the Grand Basileus, International President, CEO, Chairman of the Board of Omega Psi Phi Fraternity. 200,000 initiated members in 18 countries and on 4 continents.
I know you're a part of Omega Psi Phi Fraternity Incorporated. What is the community like you guys serve?
Yeah, again, we're a worldwide organization, right? So our whole concept is about service, whoever may need our service. We're predominantly an African-American organization, so our service outreach is primarily to African-Americans, but we don't discriminate. We're here to serve folks who need our service.
And, we're talking about brain health, and we want more people throughout the community and community leaders such as yourself to go along with this, but what makes your organization big for brain health to spread this word around?
Yeah, we're trusted messengers, right? We've been in the community now for 115 years, since November 17, 1911, founded at Howard University.
Great school.
Yeah, great school, absolutely.
Great year.
And a great year, absolutely. You know about that year, of course.
Yes, I did.
So we're trusted messengers. Mm-hmm. So whether we're talking about voter registration, whether we're talking about prostate cancer, whether we're talking about mentoring or brain health, folks believe in what we say, and we think this is a necessary message for us to get out to our community, and folks will believe that what we're talking about.
Now, I'm a doctor, I'm a neurologist, also a sleep doctor as well, and so, brain health, I can start kicking things off, but when you hear brain health, like, what does it mean to you?
It means taking care of yourself, eating properly, getting the proper amount of rest, the proper amount of nutrients, is to keep the brain flowing. Obviously, I think about mental health as well. I think mental health is a stigma we have in our community. So I just think about those things.
And, with all of those things that come, and even with Alzheimer's, it's just that us, in our community, sometimes it's just hard to talk about. Why do you think it's hard to talk about? And even with your fraternity brothers, and because I'm pretty sure when I talk about brain health and bring up Alzheimer's, you can think about some of your brothers that may have dealt with it or even have family members.
Absolutely.
So what do you think is hard to talk about?
Yeah, I think it's a stigma, right? Whether you're talking to your grandma, she's losing her memory, but she don't want to talk about it. Granddad don't want to talk about it. Alzheimer's is something we just don't generally hear about in the African-American community. We just figure, hey, just grandmama just don't remember where the keys are, right? She don't remember where the key to the back door is, but we don't say the word Alzheimer's because of the stigma. But yes, we've had members of our organization who has Alzheimer's, have died of Alzheimer's, and I think it's important now to elevate that message, to make it more open. Talk to the children about it. Moms talking about it, grandparents talking about it. And I think this is a good opportunity to do such.
Yeah, and I'm just glad that you're here because, bringing this to the forefront and even talking about it is something big that will keep that conversation going. Mm-hmm. One of the questions that I like to ask people that are not in the medical field or even not within neurology, what do you think that we can do as doctors to help people understand more about brain health?
Mm-hmm. I would say make them feel comfortable, right? A lot of folks don't like to talk about their health. Yeah. If I forgot something, I'm not going to tell my doctor because first of all, I'm thinking I just forgot it, right? If it happens for a while and my children see it, I'm gonna go tell the children, shh, don't talk about this. I'm good, right? Because first thing we think is first, mama or grandmama, or dad or mom losing memory. We're gonna put them in a convalescent home or the quote unquote old folks home, and that's the last thing old people want to do is leave their house, right? So I just think just an open dialogue, open conversation. The more doctors talk to their patients about it, the more patients feel comfortable about opening up. Also, I think the more people can bring their children to the doctor's appointment as well, right? When I go to the doctor, every time I go to the doctor, my wife come along or one of my sons come along. They're actually sitting in the room with the doctor, hearing everything that I'm hearing. And I think we do that more often. It makes it easier for the conversation.
And I think that's an important point because when you're there, when there's more ears to hear,
And more ears to hear, right?
there's a conversation that
Absolutely.
can happen amongst them. And sometimes one person might not pick up one thing
Absolutely.
compared to the next.
Absolutely.
Especially with brain health from there.
I call that advocating, right?
Yeah.
So I think the more you do that, the more you bring people to the doctor's appointment with you, I think the conversation just blossoms from there.
And I can tell, and another part that I like about these conversations, because as a doctor, I can say, like, this is why this is important. But it's good when it comes from community leaders. Why do you think it's important to talk about these small ways to find signs for brain health?
Yeah, so as from a community leader standpoint, you have a responsibility, right? For me as a member of Omega Psi Phi, thousands of Omega men who hear my voice as a trusted leader, then they have spouses, then they have children. So you're talking about thousands of people who will listen to your voice, one. Two, when you become a trusted messenger in the community, the brand, Kappa Alpha Psi, Omega Psi Phi, Alpha Divine Nine, then people listen more as well. So I just think from a leadership standpoint, it's very critical to talk about that.
Yeah, it definitely is. And now, what about like with Omega Psi Phi? What are some of the initiatives that they do within health that could be helpful for the community?
So mental health and wellness is really important for us as we encourage brothers. We talk about self-care a lot. And the thing I stress to the brothers all the time is self-care. Many times as black men, fathers, we want to be the best fathers, we want to be the best husbands. Many of us are deacons in church, and then we're in fraternities, Kappa Alpha Psi, Omega Psi Phi. Then we're coaching the baseball. And then we think about us, right? We're like number 5 or 6 down the list, right? And then it dawns on us, oh yeah, I got to think about myself, but I'm tired because I'm going to miss the doctor's appointment tomorrow because I'm just too exhausted, I'm backed up at work. So I talk about all the time the mental health piece, one, I think that's critical. Obviously, prostate cancer is really critical amongst African-American men. We talk about that quite a bit as well. In terms of being able to cope with stress, we talk about that as well. And I also encourage brothers to be careful and understand their numbers, the PSA numbers. You certainly want to understand your blood pressure numbers. You want to understand your A1Cs. So I continue to stress that as the grand bosses to the membership. Go to the doctor. Don't miss your doctor's appointments. Self-care, and be conscientious of what's happening with your body.
Do you have any stories that you can think of as far as dealing with brain health that you have learned along the way? It's like, you know what? This is something that needs to be addressed.
Yeah, it's sleep. I mean, most folks are sleep deprived, right? If you're a mom or a dad and you're working long hours and you're coming home, you still got homework to do with the kids, you're trying to get some exercise in yourself. A lot of us bring work home. It didn't dawn on us at 11:30, right? That it's time to go to bed. We finally settle in about 12. The alarm clock goes off at 5. Get the kids up for school. Wash, rinse, repeat, wash, rinse. So it dawns on you like, man, I only got 5 or 6 hours of sleep. And it wasn't good REM sleep. It was like, I got to do practice tomorrow. That's why I got a meeting at the office. So sleep is important. And the brain food, right? Eating the right kind of foods, right? Not all so much processed food. Eat some, as my wife say all the time, you got to have some color on your plate. She said that religiously, you have to have some color on your plate. So I think many times that we eat the right type of foods also, not only for our body, for our brain health as well.
Yeah, and it's funny that you bring up sleep, and being a sleep doctor. And there's a good point that you put up because not getting that good sleep, that affects your brain.
For sure.
Like when you go to bed, your brain is getting rid of all those toxins.
For sure.
And it's kind of like washing dishes.
For sure.
Like if it took you 7 hours to wash dishes and you only gave it 5, you got some dirty dishes.
You got some dirty dishes, right.
And that's what's happening in the brain because sometimes like there's these proteins in your brain that, like, if they're not flushed out, they're just sticking around, and over time those are things that can lead to dementia. Those are things that can lead to Alzheimer's.
Sure.
And so, like, the fact that you talk about it and bringing up that, warms my heart that you're talking about sleep
We
and
are.
how that is important. And that's another way that definitely can be helpful. You have the option and opportunities for those initiatives. What do you think your health fair could look like at one of the, like, local chapters to talk about brain health?
Yeah. Well, I think all of us at Divine Nine, the four sororities and the five fraternities, we all have health initiatives, right? Some health initiatives of women may be germane to women and the men germane to men, but generally speaking, health and wellness is health and wellness. And then brain health goes across both genders, right? So I think the piece that we can do more is to raise the awareness, make it part of our health initiative that we do with all our members. But also I think brothers like you, member Kappa Alpha Psi, neurologists, sisters in sororities need to elevate that as well to leadership so we can make it a priority as well to know how important it is for our members.
Which area do you think we should focus on where a lot of people don't know about?
Yeah, good question. I would say the sleep piece we just talked about. I would say brain food. Give us some awareness on what foods are healthy for the brain. And I think those two pieces that we could start with. Food, of course, we love food, right? The sleep piece, of course, that's important to talk about. I think there's going to be some pushback on the sleep because most people think, oh man, I hear it all the time, I can function on 5 hours. Yeah, man, 5 hours, I got good 5 hours of sleep, but like you can't function. You may be functioning a day or two, but not across the board on 5 hours of sleep. I think if we can elevate those two pieces, sleep and brain food, the right type of foods for our brain, I think that'll go a long way.
Yeah, and it's just understanding that, like, even with brain health, like, it can happen when you're younger, but it still can take its time and its toll. And then once you're at that point, that's when it's hard, where it's like, oh, we need to do something now, which you could have done something before in the past.
Absolutely.
And so you made that statement where people say, like, oh man, I only need is 5 hours.
That's right.
And I believe them that they think that they need 5 hours.
Of course.
But as one time we were talking about, you're depriving yourself of getting that full recharge.
For sure.
And also with your brain, you're depriving yourself of, they call it, this is the teaching moment, the glymphocytic system. Where this is something that they just found out. That's what flushes out your brain, get rid of all those toxins. So if you're depriving yourself that cleaning, then it just sticks around. If there's a message that you would want to leave, like, with the community as far as with brain health, what would you want to tell them?
I don't take it for granted. I don't believe that Alzheimer's, dementia is for grandmama and granddaddy. It starts early, like you said earlier. Taking care of yourself, minimize, stop it if you can. Smoking, cigarette smoking, alcohol. Eat the right type of foods. It really starts early because I just think there's a buildup as you go on. Because I don't think those things happen by happenstance. Some of it is environmental, I think, to some capacity, but I think most of it is ingestible, what we put in our body, right? And if we can kind of minimize that, curtail it, watch what we eat, watch what we drink, watch what we consume, I think it'll go a long way. And that's the piece we got to continue to stress, particularly to these young people who think they're going to live forever.
There's one thing I want people to remember, it's this. Brain health conversations should not start when things feel overwhelming. They should start early with honesty, support, and hope. Our communities deserve education without fear, support without shame, and conversations that help us act sooner rather than later. So let's keep centering stories, shifting stigmas, and making brain health part of how we care for ourselves, our family, our future. Thank you for being with us.
Yes.